Hey, you are watching AliAziz YouTube channel.
Histology and Pathology, the microscopic art of diagnosing disease. AliAzizQualityEducation YouTube channel provided you the medical related topics videos. So don't forget the subscription button. Histology and pathology are two intertwined disciplines at the very heart of medical science, quietly working behind the scenes to diagnose diseases and guide patient care. By examining tissues at the microscopic level, histologists and pathologists can identify abnormalities, unravel complex medical mysteries, and provide crucial insights into a patient's health. In this article, we delve into the world of histology and pathology, exploring their purpose, techniques, and the human element that makes them so vital to modern medicine. What is histology? Histology is the study of the microscopic structure of tissues. It is often referred to as the science of tissue as it involves preparing, staining, and examining thin sections of tissue under a microscope. The goal is to observe the cells and their organization within different types of tissues, whether from normal, healthy structures or from those affected by disease. Histologists prepare these tissue samples using a series of careful steps, including fixation, embedding, sectioning, and staining. The prepared slides are then studied under the microscope, revealing the intricate architecture of tissues that is invisible to the naked eye. The insights gained from histology are crucial for diagnosing diseases, understanding their progression, and guiding treatment decisions. Pathology, the science of disease. Pathology is the broader discipline that focuses on the causes, development, and effects of diseases. Histopathology, a subspecialty of pathology, specifically deals with the microscopic examination of tissues to study disease processes. By analyzing tissue samples from biopsies, surgeries, or autopsies, pathologists can identify abnormalities such as inflammation, infection, or cancer. In this sense, histology provides the raw data, the tissue architecture and cellular details, while pathology interprets this information to reach a diagnosis. Together, these disciplines form the backbone of diagnostic medicine. The role of histology and pathology in diagnosing disease. The primary purpose of histology and pathology is to diagnose disease at the cellular and tissue level. This process often begins with a biopsy, where a small sample of tissue is taken from a patient for analysis. This tissue is then processed by the histology laboratory, where it is prepared and stained for microscopic examination. Cancer diagnosis. One of the most critical roles of histology and pathology is in the diagnosis of cancer. Tumor samples are examined to determine whether they are benign, non-cancerous, or malignant, cancerous. Pathologists assess the characteristics of the cancer cells, such as their size, shape, and how they interact with surrounding tissues. This information is vital for determining the stage and grade of the cancer, which in turn guides treatment decisions. 2. Inflammatory diseases. In conditions like Crohn's disease, rheumatoid arthritis, or lupus, histological examination can reveal patterns of inflammation that are key to diagnosis. Pathologists look for telltale signs such as immune cell infiltration, tissue destruction, or fibrosis, scarring. 3. Infections. Certain infections leave distinct microscopic traces in tissues. For example, fungal infections may be identified by the presence of specific fungal structures within the tissue, while bacterial infections might cause particular patterns of inflammation. 4. Autoimmune diseases. In autoimmune conditions, where the body's immune system attacks its own tissues, histopathology can provide evidence of the damage caused by this abnormal immune response. For example, in conditions like lupus, Kidney biopsy samples may show inflammation and immune complex deposits that help confirm the diagnosis. Histological techniques, stains and microscopy. To make tissue structures visible under the microscope, various staining techniques are used. These stains highlight different components of the tissue, making it easier to identify abnormalities. Two of the most common staining methods are hematoxylin and eosin, H&E, staining. This is the most widely used stain in histology. Hematoxylin stains the cell nuclei a blue-purple color, while eosin stains the cytoplasm and extracellular matrix pink. The H&E stain provides a clear contrast between different cellular components, making it easier for pathologists to observe cellular structures and detect abnormalities. Special stains. In some cases, additional stains are used to highlight specific tissue components or pathogens. For instance, the periodic acid Schiff (PAS) stain is used to detect carbohydrate-rich structures, such as the glycogen stored in cells or fungal organisms. Similarly, the Zeil-Nielsen stain is used to identify acid-fast bacteria like Mycobacterium tuberculosis. 3. Immunohistochemistry, IHC. In more complex cases, immunohistochemistry is employed to detect specific proteins within the tissue. This technique uses antibodies that bind to target molecules, which are then visualized with color-producing reactions. IHC is especially valuable in cancer diagnosis, where it helps determine the type of tumor and its potential response to targeted therapies. Innovation and advancements in histology and pathology. Advances in technology have revolutionized both histology and pathology in recent years, enhancing diagnostic accuracy and efficiency. Some key innovations include digital pathology. The traditional microscope is increasingly being replaced by digital pathology, where tissue slides are scanned and viewed on a computer screen. Digital systems allow for easier sharing of images among pathologists and specialists for second opinions, and artificial intelligence, AI, is being developed to assist in diagnosing complex cases. Molecular pathology. Molecular techniques, such as PCR, polymerase chain reaction, and next-generation sequencing, NGS, have allowed pathologists to analyze the genetic makeup of tumors. These techniques provide insight into mutations driving the disease, which can guide personalized treatment options, especially in cancers. 3.3D Histology. Traditional histology examines tissue in 2 dimensions, but 3D histology offers a more comprehensive view by reconstructing tissue structures in 3 dimensions. This is particularly useful in understanding the spatial relationships within tumors and for visualizing complex tissue architectures. The human touch in histology and pathology. Despite the technological advances, histology and pathology remain deeply human disciplines. Behind every tissue sample is a patient waiting for a diagnosis that could change their life. Pathologists and histologists bear this responsibility with care and precision. It is their expertise that ensures the correct interpretation of what the microscope reveals, and their dedication that ensures patients receive the right treatment. In the laboratory, there is also a commitment to quality and meticulous attention to detail. The preparation and handling of tissue samples require patience and skill, knowing that even the smallest error could impact a diagnosis. Beyond the science, empathy plays a role too, understanding that every slide represents a person, a family, and their hopes for recovery. Conclusion. Histology and pathology are integral to understanding disease at the most fundamental level. Through the study of tissue structure and cellular abnormalities, these fields provide crucial insights that inform medical decisions and ultimately save lives. While technology continues to evolve, offering new tools and methods for diagnosing disease, the human expertise of pathologists and histologists remains the core of this life-saving work. In every tissue sample examined under the microscope lies a story of the body's struggle, its resilience, and sometimes, its fragility. The art and science of histology and pathology continue to bridge the gap between the visible and the invisible, guiding us in the fight against disease with compassion, precision, and innovation.